Hi, how are you, everybody? Thank you for joining us. Thank you for being with us and to follow us. I want to say just a few words before I start this case today. So, thank you for all the sponsors of the center. So, Perfetech, Fujifilm, Pentax, Medical. Thank you for the great meetings during DDW, and also my good friends. Uh, Brian, Stephanie, Igor, Peter, thank you again. Donains. So, and also Chris Lee, thank you for support us. And sorry for any kind of delay, but well, I want to announce that in few days we will be in Endoscopy on Air. This is the first Endoscopy on Air of Americas. It's directed by my good friend Moeb Kashab, and well, we will start to show it just basic cases because we want to share with all the team, with everybody, how to do it. Small things, small therapeutic things that we can do it, and we want to start to teach this kind of therapeutics initially because 90% of GI in their own practice can do it. So this is what will be the focus of this endoscopy on air Americas. So now I'm with a 41 years old woman with achalasia type 2, recently diagnosed. So I am just below the cardia here. So I like to cut 2 centimeters down from the cardia. This is the cardia now. You can see here very well. It's almost 35, so 38. And then I will start to cut here to get my tunnel here. So perfect. Now I will pass. I'll clean a little bit. And I like to start in the posterior wall because of my scope. I like my scope. This is the Pentax scope, the 29i10 I20C series. So it's from Inspira, right? So, and now I will perform my injection. I love to use Blue Boost from Microtech, and I use the needle from Microtech. Is a 3 millimeter needle just to go inside the submucosa directly. Open, abre. Now injecta. You see very well. So I inject. Okay, termino. Sí. So now that I injected, now I will start to do my tunnel here. There is some vessels there, so I want to try to avoid it. So very nice DDW. I like it. I want to say thank you to Pratik Sharma also, past president of ASGE, for the nice invitation and and share with the friends. I believe was amazing congress. Abre. And also to my good friend Tony Siracusa for the kind invitation to Crystal Award. So now I start to cut. I am using the flush knife from Fuji because when I have this kind of patients that is first time, without type 2, no difficult cases, I prefer to start with this knife. So once I get the cut, I use pure cut for the beginning, and then I start you have to dissect the submucosal tunnel to get inside. This is the best and the most important part. At the beginning, I didn't understood. I have fear to cut the muscle layer at the beginning when I start to do it. Huh? My good friend Michelle Kehela teach me how to do a poem. So now we are doing in Ecuador, and I believe near soon in other countries will be more available, right? Many people is training now. I hope soon in Paraguay with Dr. Sadi Gauto, Sadi Modesta Gauto, right? As she said. And well, now I have the tunnel. You see, it's easier. Once you get the tunnel, it is very important to make the dissection of it is very important to make a good dissection. So now I will do my dissection of the tunnel, and I will use sprite coagulation. I like to use this mode because I feel that I go faster, and to be honest, I go faster. Huh? What time is now? It's 12:53, so we don't have like too much time starting. And you can see when you do very well, when you do right, you can make coagulation without changing the scope, right? So now, okay, now we are here. You see the vessels? With the sprite coagulation, you really make a good coagulation, and this is why the reason I prefer to use this. Okay, so now we need to inject. So in few days I will join you in Houston. So I was invited by Professor Mohammed Othman. It's a real pleasure to be there in his course. Amazing course to those one that wants to learn and make a hands-on, on animal models or other models, just to train in third space, as is this one. So you can. I believe there is still some tickets. You can purchase it, and going there, you will be meeting a lot of very big professionals in this area, the third space area. We will use new technologies as microwave technology from Cryomedical. So I believe will be a very nice opportunity to meet us, join us, and work with us how to work in the third space, right? Now I will inject a little bit more. So we saw some vessels. So no scare about that. Okay, so just a little bit because I believe that is the mucosa. So here is the tunnel. This is very important, The orientation is very important is one of the things that I believe is the most important. You see the muscle down. You see that is at 11 o'clock is the mucosa, and this is a tunnel. So this is my space. This is my third space. I am creating the third space now. You see, it's very important, the injection, and we need to push a little bit your scope, and then I start to make a dissection. You see, very well. Sometimes you can have some inflammatory areas with fibrosis, but because of this kind of patient with achalasia, sometimes they made a lot of infection by fungi. So in those cases you need to treat first a few days and then coming back, because if not will be impossible. So now I am creating my tunnel. You see, I am opening my space. Okay, so now I create a little bit more my space. I am almost, you see, I am almost in the cardia now. This is very important. Now I am starting to see the gastric vessels coming there. So I need to open a little bit more this area because I want to have more space when I will cross the cardia. And this, you see, there is a vessel that there, this, at 6 o'clock. So I want to burn it from the muscle. You see? In that way, I avoid the bleeding, and I like it to work in a clean space. I don't like it the bleedings, to be honest, because it takes me too much time sometimes. So you see, now I open it more, and I'm very good. I'm just crossing the cardia now. So probably I will finish in few minutes, I hope, if there is no any risk or any perforation or whatever of this kind of complication that we can have. Is very important. You see, very well. I pass. I believe I pass. And you can see, nice. I believe when you are doing the tunnels like this one, or you are doing an ESC with a tunnel, this it depends also if you are in the colon, right, or in the stomach, but esophagus and stomach I believe is very good. And also, you know, you can, you see, I'm open a little bit more, because I want that my scope pass very well, you see. Very good, you see. So there are some vessels, big vessels I believe. just here. I will try to inject. There's some fibrosis area here, but this is normal. Sometimes we can have it, but it's because of the food impact here in this area. So it's something that happens, huh? It's not that it's you can see very well the movement needs to be very smooth movements to avoid complications. At the beginning, I had a lot of complications, I believe. Well, not complication, but at least mucosa damage, and this is something that we need to avoid because if not, you need to take more time. Putting clips, also spending more clips during your procedure. So this is a vessel. Now I cut it. Okay, let me see. Okay. I need to cut a little bit here. Perfect. Okay. I will advance few more centimeters. So 1 centimeter more, and I am done. Okay, let's go to see where we are. I believe I am inside the stomach now, to be honest. So I will remove. I'm out. Now I am out. So a little bit more, huh? So we are here, you see? It is okay. So we are here, so I need to push a little bit more. Just 2 centimeters more will be fine. And we are almost done. So there is a vessel there, you can see. So maybe I will quag a little bit, or maybe I will less it. So I need continue dissecting here. Very good. Now we are better, I believe. Huh? You see? Very well. Okay. I want to dissect a little bit better. You see, it's a big vessel here, huh? Okay, let's see. Perfect. Now I will cut this one. Perfect. So I cut too deep. Now I am dissecting the submucosal again, but it's nothing to be worried, okay? The important is to have very well the delimitation between the muscle. You see, I cut the muscle there, okay? Because I didn't have too much space. I didn't want to make a hole in the mucosa. And now that I have better space, I'm dissecting again the submucosal, and I taking again my dissection tunnel. You see? So the muscle is there, it's good. Look at that vessel. You see it? Very big vessel. You see? This is from the stomach, okay? So I will go down. It's better. And you see, with the sprite coagulation, opa, you see, even with the sprite coagulation, sometimes it's not so easy, huh? But well, now I believe it's done. It comes from the deeper part of the muscle layer. Some areas here I need to coag, but I believe it's almost done, huh? I want just to put very good. Well, now we are done. I will just put a little bit more here. We are now in, yes, So I dissect 4 centimeters more. Why? Because the esophagus little tortuous. That is a mucosa. Let's make a little coagulation here. Okay, perfect. Okay, so now look the vessel down. You see? This is very important to see what you are doing, and every bleeding needs to be stopped, because if not you can have a delayed bleeding and it's not good. So I will inject here a lot because I want to see from the stomach if I am okay. I believe I'm okay, but I will be reassured here and I will start to make my cut. So we did a big tunnel. We made a big tunnel. So now I will start to cut. I'm here. Perfect. You can see here my bull. So I'm in the stomach. I'm perfect now. So I have to cut now. I will cut and we will finish. So I will start my cut here, okay, of the muscle going down, okay. Thick muscle, which is normal to see. So now we did a full thickness. I like to make a good a full thickness resection first because I go faster, and second because I don't have any different results between doing full thickness and not doing. You see the longitudinal fibers there? I cut everything. Sometimes I do some coagulation because I want to prevent any kind of bleeding. My first time when I start to do a poem, I was with Michelle and we had a big bleeding from a deep vessel coming from the muscle. It was very difficult to stop it. So that's why I prefer to make a you see, I make a spray coagulation. I create the tunnel down. This is my practice, right? There is a lot of physicians that they do it in different way. That is nice from poem. What I believe is that we don't have like we know the technique, like how to do it, but different modes that people use when they are doing their own poem. Now it will depend on how was you train it and how was your experience. I have to be honest, when I try for first time the spray coagulation, I love it for make the tunnel. Very good, you see? Very, very good. So these are some vessels. Okay, now we are advancing. Very nice, you see? Very good. I'm creating my tunnel now. I'm doing the full thickness resection now. You see? Okay, don't worry. Now it's perfect. So that's peritoneum. Perfect. Well, we finish now. Perfect. Okay. It's okay, huh? Patient is okay. So you see peritoneum here, so it's okay. So now we'll clean up a little bit just to see if there is any blood vessel. Oh, sí puede ser. Momento, déjame ver que algo está sangrando. So here is. Okay. So there is a bleeding here, you see? So now I want to see where is the bleeding. Okay, the bleeding is here. Préstame. Sí. I see the bleeding, you see? It's here, it's in this vessel. So I will use the flush knife again just to make a coagulation here. But probably just with the clip will be fine, but I prefer to make a... to stop the bleeding before, right? Just to be completely sure and not coming back because of bleeding. ¿Está abierto? Okay. Now we are done. So let's see down. Okay. Now it's open, you see? This is because it's okay, so I don't have to close here. I have to close here. Okay, now. So I need the clips. I will use 16 millimeter clips. And we will finish. Abre. Cierra. Cierra. Alright. I put the brake on my wheels because I like it to be stable in this position when I am putting the clips. Because the esophagus is tortuous, so you can lose the area. So it's better to be stable. It's one of the tips that I can give you to be stable. Okay. Abre. Abre todo. So Milena, my assistant, she knows very well the position. You see, I don't have to say anything to her, but she's doing very well to close it. And now I need to cierra ahí. Cierra. Very well. I think one more clip will be enough because I did just a short space, right? Short incision. So with short incision you have nice space, one more, and that's all. So I finish. I believe I finish. Thank you for joining us. So don't forget, ¿cuándo es que estamos en Endoscopy On Air? ¿Dónde está Juan? ¿Cuándo es Endoscopy? So 27 May, Dr. Alcibar, we will showing you how to do a band ligation, and myself how to do an EMR. So very nice. So we will talk also about magnification. Will be super nice. I believe pattern recognition is very very nice also, you know, to understand Abre. In that way you can do your treatments in a better way and identify, not just treat, identify, you know, the way that you need to treat the lesions. So this is very important, okay? So it will be 1 hour with us. Cierra ahí. Cierra todo. Okay. So we finish. Everything is closed. Let me see. Very good, you see? And the tunnel is open, so the cardia now is open very well. Don't worry about this. This is just not a perforation. Thank you. See you soon.